The aim of this retrospective observational core study is to assess sport activities effect and frequency in a large population of adolescents with idiopathic scoliosis. The association between sport and spine deformities is still controversial, with some studies reporting an association with the progression of scoliosis and trunk asymmetries, and others showing similar trunk asymmetries and idiopathic scoliosis prevalence in athletes and non-athletes. All around the world, some physicians advise in favor of sport and others against sport. Patients and parents are puzzled between these two extremities and often ask for advice on choosing the best sport to prevent idiopathic scoliosis onset or its progression. The secondary aim was to investigate which factors influence scoliosis progression. We included a large number of patients with 10 years or more, with Cobb degrees 11 and 25, with Risser between 0 and 2, follow-up visits at 6 and 12 months, and radiograph follow-up at 12 months. In Italy, many adolescents engage in extracurricular sport activities. The out-of-school sports participation as type of sports, frequency per week, have been questioned by the physician at the follow-up at 6 months. If patients did not practice sport or practice any sport just one per week or inconsistently in 6 months, they were classified as no sport and compared to those practicing sport on a regular basis. The no-sport group showed a higher risk of progression and failure than participants in a sport group. Logistic regression confirmed that the more frequent sport activities, the less probable progression and failure were. This study shows that sport activities associated to scoliosis treatment have a protective role against progression at the 12-month follow-up in adolescents with milder form of idiopathic scoliosis. Excluding high-level sport activities, the risk of progression and failure decreased with the increase in sport frequency per week.